We are going live now. Let me see, counting down. You might want to welcome our guests. We're live.
Hello, good afternoon, good morning, good evening, wherever you are. Again, a beautiful Sunday out here in Belton, Texas, and I hope everybody's staying safe and adhering to all the laws and regulations of the land that are trying to keep us safe. A lot of states right now have opened up some avenues of how people can go out and gather 30, 50 and things like that, as well as encouraging the social distancing. I hope we're all practicing what they're telling us to practice. Online, I have my beautiful sister, Reverend Pam Fomunung, who's live, of course, is beautiful as ever. And unfortunately today, and our guest, Dr. Stella Emmanuel, is running a little bit late, but whenever she comes in, we will stop whatever we're talking about to let her come in, because she is the expert of the topic that we're going to be discussing today. And then my host, Mr. Niasong, also is running 1 or 2 minutes late, but he will join us shortly. But nonetheless, yours truly here. We'll keep you online and entertained for now. Reverend Pam?
Thank you so much. Man, look at you. You look like you're 21. Hey, Grandma.
Oh,
go, Grandma. Go, Grandma. Loving the red afro. You know, we Nubian princesses, we are blessed. We don't wrinkle. Our people don't wrinkle.
Amen.
So, yes.
Amen. They say black
yes.
Yes.
Thank you so much. Yes. Dr. Stella Emmanuel, who is a pediatrician and now family practice, she just left church, so she'll be on shortly. But we're going to be talking about COVID-19 manifestations in children. I think was it last month or earlier this month, we talked about a CDC alert in children, and parents really need to pay attention, you know, because they have these manifestations of COVID-19 in children called multi-system inflammatory syndrome in children, or MIS-C. You recall when this thing broke out in Wuhan, China, some people were saying that prematurely, of course, that it doesn't affect children. I mean, I even had some people on mainstream media saying, oh, maybe it doesn't affect children because children have not abused their organs like adults, you know, with cigarettes and alcohol and all. They're coming up with all these stories. Yet, you know, it's a new, it's a novel virus. It's a new strain. And people are not even, we don't know the half of it yet. We don't even know the quarter of it yet. So people were speaking prematurely. So today we want to address this, you know, as most of you know, at the end of every month, the last Sunday of every month, Africa Online Media Corporation, we discuss a health topic. We've done that for 4 years. We've done that for 4 years. You can visit our Facebook page and you'll be able to access some of them. And you can also purchase the Africa's Brain Power book that has a compilation of the editorials from March 2016 when we started to December 2017. So you'll be able to read all those editorials there, written by the best in the business. Mr. Asonglefac Nkemleke, a former professor of journalism in Cameroon and one of the first English-speaking journalists in the country, an icon. He'll be joining us shortly. But yes, that's what we're going to be talking about. But while we are waiting for the chief executive editor, Mr. Asonglefac Nkemleke, whom we popularly call him Ni Asong, to zoom in, we all know what is going on in this country, and we need to lift up this country in prayers. Some of the protests are spread even to London, the US Embassy in London. We Africans, we Black people, we are all one, and nobody is exempt from what happened to Mr. Floyd. Nobody. He was not a dog. You know, you cannot say, oh, he was doing something and then they killed him. You know, nobody has a right to take anybody's life. Nobody has a right to take anybody's breath. You know, we all know that God gave us breath. God gave us life. in Genesis 2:7. I'm not trying to preach at you, but God created us from dust and breathed into man, our nostrils, the breath of life, and we became a living soul. So only God has the right to take away our breath. Some people, they use the phrase take my breath away to show a positive reaction to somebody impressing them. But I would discourage our people from using that phrase, because the wicked people, the police and the racist people are taking our breath away, basically killing us. So the chief executive editor, our primary anchor, Mr. Asonglefac Nkemleke, is on. You are welcome, Nia Song, and I'm going to hand over the microphone to you. I've already introduced the topic. Take it away, Nia Song.
Good afternoon. I may not stay the length of the program because the hospital is trying to do a FaceTime with me.
Okay.
They've made 2 attempts that failed, so I'll see what to do. All the same, good afternoon. And this is Africa Online Media Corporation, and we're happy to be here today, this Sunday, the last Sunday in the month of May. Welcome, Sylvia. Welcome, Pastor Reverend Pam. And I hope that our doctor will be coming, because I look forward to having all of them in, because this is something I am as blank on as a blank check. All that being said,
she'll be on.
That makes 2 of us.
Yes. Okay. All right. So let me be saying this while she dials in or while she zooms in. I'm on the phone rather than the computer, because I didn't have time to set the computer up. So let's see what we have here. Hello and welcome to the last live broadcast this month of May. Not the last live broadcast of Africa Online. No, don't be scared. We're not going away. We're not going away. So today is May 31st. It is the 152nd day of 2020. And there are 214 days left until 2020 sits its place to 2021. The time is going away, isn't it? May is already behind us virtually. So to Christians, today is Pentecost, a day that commemorates when Jesus Christ sent the 3rd person of the Trinity, the Holy Spirit, to be with and to strengthen the disciples. That story is told in the 2nd chapter of the Acts of the Apostles. It is not a holiday, but a holy day, considered to be the birthday of Christianity or the Christian faith. In these days of coronavirus, humanity worries and wonders. We worry and we wonder, not so much because of the invasive nature of the virus and the respiratory disease it brings in its wake, called COVID-19. We worry and we wonder about its devastating effects on the entire human race. The health of the human race, businesses done by the human race, education, and you name it. Everything that the human person does, is engaged in, has been affected by this coronavirus and COVID-19. Health is always the crucial element here, because when we are sick, when we are ill, when we cannot stand up, we cannot live our lives in full, let alone go about our chores and duties and other responsibilities. And as if that is not enough, the virus is now known to be causing illnesses in children too. But just how much do we know about COVID-19 and children? That is our topic today. How is it affecting our children? What exactly is happening to our children? And what are the medical professionals doing about it? Apparently not very much though, but they are working. But health professionals, as I wanted to say, are not giving up. As Anaxagoras, a Greek philosopher, once said, appearances are glimpses of the unseen. So they are seeing the appearances, they are having the glimpses, and they are doing all they can to find out exactly what is going on. So our health professionals and healthcare organizations have watched the evolving situation and noticed that children are not being spared by this novel happening. Children are being infected by some phenomenon which only experts are yet able to name. We hope that some of those experts will be able to zoom in today on this program to be able to shed the light, to be able to tell us what the symptoms are, and to tell us just what is happening to our young population, to our younger people. Confident of that, we agree with Albert Schweitzer that we should all be thankful for those people who rekindle the inner spirit. Yes, our healthcare experts have never lost sleep in their efforts to rekindle that inner spirit. And in so doing, they have given humanity hope, reason to hope. And of course, we must hope, because if we lose hope, we will be lost. And as Eleanor Roosevelt, one-time First Lady of the United States, said, you gain strength, you gain courage, and you gain confidence by every experience in which you really stop to look fear in the face. You are able to say to yourself, I lived through this horror. I can take the next thing that comes along. So we are confident that with all the health expertise being put in, we will be able to live through this horror, and we will be able to take the next step and be able to live our lives normally again. That said, Reverend Pam, that said, Sylvia, over to you. Let's see what we're doing here now.
Yes, thank you. And you made it and you came on, and sorry that you have to leave early today, but it's always a pleasure to see you, my dear, and may God continue to bless and protect you and your family.
Yeah.
With regards to children, I'm also very oblivious to this, because I went with a song that everybody was singing in the beginning to say it was not affecting children. So truth be told, or truth be known, I really have not done even much research on it. The only thing I know is I'm very overprotective of my grandchildren. When I see them, where we live at, there's a very big cul-de-sac here. And there's a lot of children that, come out and play with their rollerboards, with their bikes, with their whatever gadgets they have. Now, when you see the innocence of these children, the way they play, and you try to tell them, oh, don't touch him, or don't touch this, it's like, wait a minute, what's going on here? They kind of sort of look at you in a funny way and say, what's your problem, Grandma? Mm-hmm. But being told that this virus is affecting these children, I'm sorry, I should tell you, I'm paranoid for my grandchildren. I haven't seen or haven't witnessed one child yet that has been affected, but by God's grace, I hope it's not that many, because if the adults are failing to cope, if the adults are struggling to cope, if the adults are going through this trauma, I can't just imagine what happens to a child. I watched a video from, I think it was from India or somewhere in Malaysia, I think about a week or two ago, where he was a 7-year-old boy. And apparently he had contracted, COVID, and he was doing all these, it's like he couldn't even speak, but he was trying to communicate with his parents, telling him that he was, because he kept grabbing his chest, like telling them, I can't breathe, but he couldn't talk. So when a neighbor came by who's married to a doctor, she said, oh, I saw this with so-and-so's child as well, your child has COVID. So the entire family ran out of the room, went and locked the child inside the room, and went through the window, which had a door. And they were talking to him through there and serving him food through there, and he could not get up by himself to get the food. So if this is affecting our children like this, how are we as parents supposed to take care of them? Because most of us are not even medically inclined, like a person like me. Okay, my daughter is a doctor, yes, but left up to me, believe it or not, I would not know, and I do not know what I would do to be able to comfort the baby or to comfort the child, that is going through this trauma. So I'm really, really looking forward and very anxious and excited to have our guest speaker, Stella Emmanuel, to come and give us some education, or to come and give us some insight on what our expectations are as parents or as guardians or grandparents or whatever you are towards the children that are within your life or the children that are within your house. Then, of course, earlier on, Reverend Pam talked about what's going on the ground of our Black people and things that are going on. That also is very, very disturbing for me. It's a very, very sore topic. Every time I think about Mr. Floyd, I mean, tears just start running down my face, because I watched the man die in my face, in my eyes, and there was nothing.
We all did.
And the people that were there, there's nothing they could do. Had that woman tried to even help him, she probably would have been shot, or she probably would have been arrested as well and thrown down and
killed.
That's what I thought. Yes, yes. So we also have to find time to talk about our own people and our own problems, our own issues that are facing us in face right now. As Black men and women, yes, we have arisen. Yes, we demonstrated. Yes, we have cried. We have screamed. We have thrown stones. We have burned down buildings. We have done almost the imaginable because they've driven us towards the wall. We're caught between a rock and a hard place. We talk about unity. We talk about freedom. What freedom does a Black man have in the United States? What freedom? Every time a Black man walks outside, he has to always be like clenching himself or clenching his teeth. Anything can happen. Anything can happen. The minute you see a cop, you almost like you want to run or you want to, escape somehow. Because being Black is a crime in the United States. Being Black is not a thing when you're in the United States when the cops are around. I have grandsons growing up crying out loud. What am I going to tell my grandsons? How do I teach them? Believe it or not, we live right next door to a sheriff. We live right next door to a sheriff, and he's a white sheriff, by the way. This is one of the most peaceful men I've ever met. He every morning, good morning, ma'am. He'll come in the front yard, good morning, and the children, he'll greet all of them. If he has candy, he gives them candy. So now I'm saying the disparity between the good and the bad cops is really phenomenal. Because the few good ones you rarely even see outside, or you rarely see them, in action. But it's the bad, like the idiots that the stupid fool that his neck on the Floyd and his cohort looking on. They better prosecute all four of them and not just one person, because those other three fools, the stupid police that were there, could have stopped that. They were accomplices. He was already restrained. He was not struggling. He was fighting. His last words, like somebody wrote a very beautiful poem that I can't recite because I don't have permission to, but I'll just take a few sentences out of there. The first thing you say when you're born or when you start to learn how to talk is mama. Mm-hmm. Some of them start with dada, but either one, it's a parent. It's calling the parent the father, mother. Mr. Floyd's last words were mama. I'm dying. I can't breathe. I can't breathe. Lord have mercy. I am so angry. I had no words. I tell you. It took me 2 days to write up something because my emotions were overtaking my brain capacity. I couldn't think. All I felt was anger. And when I saw the sheriff yesterday, believe it or not, I didn't even say hi to him. Because now I'm feeling some kind of way towards every cop. And that's not fair either.
Yes. My sister just calmed down. At the top of the hour, we'll make some announcements about that. But while we're waiting for our guest, today is Sunday, she just came out of church. I want to read something, okay? And when you were talking earlier, you alluded as to this question, what parents do and how you're protective of your grandchildren. So I'm actually just reading this from the CDC alert, okay? I'm going to read it so that our people can hear. It says for parents, multi-system inflammatory syndrome in children, abbreviated MIS-C, associated with COVID-19. What we know about MIS-C, I want to encourage you also because nobody really knows everything about this. This is new.
Yes.
It's a multi-system inflammatory syndrome in children, MIS-C, is a condition where different body parts can become inflamed, including the heart, lungs, kidneys, brain, skin, eyes, or gastrointestinal organs. We do not yet know what causes MIS-C. However, we know that many children with MIS-C had the virus that causes COVID-19 or had been around someone with COVID-19. MIS-C can be serious, even deadly, but most children who were diagnosed with this condition have gotten better with medical care. Now it says what to do if you think your child is sick with MIS-C. Again, I'm just reading this, so we're waiting for our guest to zoom in. This is for parents or caretakers Contact your child's doctor, nurse, or clinic right away if your child is showing these symptoms. I would like to add there that if you don't have a specific doctor, a pediatrician, or a family doctor, you don't know a nurse or a clinic number, just call 911. You know, they didn't put 911 there, but I'm saying that that's what options for people who don't have the luxury of a family doctor. These are the symptoms: fever, abdominal pain, vomiting, diarrhea, neck pain, rash, bloodshot eyes, feeling extra tired. Be aware that not all children will have all the same symptoms. Seek emergency care right away if your child is showing any of these emergency warning signs of MIS-C or other concerning signs. These are the emergency signs: trouble breathing, pain or pressure in the chest that does not go away, new confusion, inability to wake or stay awake, bluish lips or face, severe abdominal pain. This last 6 symptoms I just read, you have to call 911, even if you have a family practice doctor. And then they go on to say how doctors will care for your child. It says doctors, again, I'm reading from the CDC website, doctors may do certain tests to look for inflammation or other signs of disease. These tests might include blood tests, chest x-ray, heart ultrasound, or echocardiogram, abdominal ultrasound. Doctors may provide supportive care for symptoms, medicine and or fluids to make your child feel better, and may use various medicines to treat inflammation. Most children who become ill with MIS-C will need to be treated in the hospital. Some will need to be treated in the pediatric intensive care unit, PICU. I used to work in that when I got out of school. Parents or caregivers who have concerns about their children's health, including concerns about COVID-19 or MIS-C, should call a pediatrician or other healthcare providers immediately. Healthcare providers can follow CDC recommendations to keep children and their parents or caregivers safe if an in-person visit is needed. Okay, Dr. Stella is just getting in at the right time. She's connecting an audio, and the CDC goes on to list the things that they don't know about MIS-C. It still says that, Dr. Stella, you're muted. It still says that they're still learning about it and how it affects children. So they don't really know why some children have gotten sick with it and others have not. They say we also do not know if children with certain health conditions are more likely to get MIS-C. These are among the many questions this is still working to try to understand. It says all CDC recommendations are based on the best data and science available at the time, and we will update them as we learn more. Okay, I'm gonna stop there. I was just reading that right from the CDC website. Dr. Stella, you're welcome. Let me unmute you because you are not muted. I mean, you're muted. Dr. Stella, can you unmute yourself? Yeah. And we also want to welcome one of our participants with a 301 area code. If you want to speak, you're welcome to the show. If you want to speak, you can unmute yourself. Dr. Stella, the show is all yours. We're talking about COVID-19 and children, and also specifically the multi-system inflammatory syndrome in children that the CDC just alerted last month on. Your camera is not on. I don't know if you want to turn it on.
Okay, let me turn. Okay, hold on.
The hat.
You see me?
Yeah, yes. I love the hat. Maybe when Dr. Ogoji.
Yeah, me too. I know. I just left church. I just came back from church.
Sorry.
I just got out of church.
Yeah, so you're welcome. Thank you for pressing away. Nia song was on. He had to do a FaceTime with the hospital. He probably got back in, but he has a family member in the hospital. So we'll continue to keep him in our prayers. So
hi,
you're welcome.
Hey, doctor.
Anyway, hi, good afternoon. Hey.
Good afternoon.
Anyway, usually we were talking about, which is, I think that's good news. Based on a lot of evidence right now, or from what we've seen, okay, like I always say, COVID is a novel disease, it's a new disease, so there's a whole lot of stuff we don't know about it. But from the strain that we've been dealing with right now, they've not shown much. They've done, in fact, I think there's some studies they did in China, and they said among all the people that were children that were infected in China, they said below the age of 10, they probably had one death. That was what was reported. But like but COVID, of course, is a moving target. So they say children don't appear to be at higher risk of getting COVID than adults. So, they do not appear to be, but it's just that they don't show symptoms. They probably carry it, and they also say that they probably don't even transmit it to adults. But of course, like I said, it's a moving target, but so most of the cases that have been reported as really being in children and have been in adults, what I'm saying? But they say different people we've had patients, not personally, but I've had colleagues show up. There's a rash that the children get, like a red rash on the skin. I think I've seen it in adults. So I've seen it in 2 adults that their symptom was they were positive for COVID, and then they had this red blotchy rash. But we've had children that have like those blotchy rash, almost looking as if they have a hand, foot, and mouth disease, but of course they don't have any mouth symptoms, just really a red rash and everything on the feet. But so far we haven't, we've not had. I've had 1 or 2 physicians, because like I said, I'm on this physician group online. We've had some report COVID in a newborn baby, that a premature baby, and of course the premature baby had all other complications.
Yes.
So they've reported 1 or 2 in that, and of course, and then they've been talking about a multi-symptom disease that kind of looks like Kawasaki. I'm not sure whether that is actually COVID or it's just Kawasaki, because Kawasaki disease happens. So they have a multi-system inflammation that shows up in children that kind of shows up like Kawasaki. That they have like mouth symptoms, they have like a rash all over their body, and it's kind of like an autoimmune response, almost, because you see the Kawasaki response is almost like when they talk about when COVID patients get into what they call the cytokine storm. It's when the inflammation has gotten to multi-system, it's gotten to the heart, to the kidneys, everywhere, and then there's just a whole lot of toxin being released. It is that cytokine storm that actually ends up killing the people. It gets into the lungs. It causes like a DIC. DIC is disseminated intravascular coagulation. It causes a DIC kind of picture. So they've been talking about that. They've reported about it, but we don't know. We don't know how. They said we should be alert on it, but I'm not sure about how that, whether it's COVID or maybe a child that had positive COVID just had Kawasaki, because children do get Kawasaki disease, And but one of the things that we worry most about children, especially in COVID, is fear, and the fact that their lives have been interrupted. Something that is. I think the more thing that we worry about in children is they're not in school, they're not with their friends, they're at home, and sometimes in abusive families, sometimes starvation. Those are the things that I worry about children and COVID. Something. So, they worry about, and then a lot of the children don't understand what's going on. They just know that, okay, grandma died. There's a whole, they watch TV saying, oh, millions of people are going to die. So a lot of children are under stress.
Yes.
Some they are under fear and stress. They are fretting, they are worried, they miss their friends in school, they miss their family members. They're telling them that they cannot go visit their family members, they cannot go visit grandma at the nursing home. Something, they miss the school staff. They are telling them that they cannot trust anybody because everybody around them can give them this disease. So even though, and it has actually, last week we were talking about the media hype. The media hype, I don't know what has been their, what's their motive, but the media hype and all the things that they have been saying has just increased the anxiety and fear among a lot of people. And somehow they are not getting across the idea that, children rarely die from COVID. They're not getting across the idea that even people below the age of 60 rarely die of COVID anyway, or people even below the age of 65, below the age of 40, the death rate is like 0.0 something. So they are not giving this out. They're just talking about, oh, everybody will die, and that is part of the media thing that is really driving, So the most important thing that we have to do for our children, one, is to remember that the children hear what we say, they hear what is said on TV. and they react to it. They pick up cues from our conversations and from what other people are saying. And then they see the way the house is, everybody's tense. They think about the fact that, oh, people are wearing masks. So we have to find time to talk to our children, because most of the time we don't talk to the children, and we assume that they process things the same way we will process things. They process the risk the same way we will process the risk. So one of the most important things that we have to reassure children and let them know that they are safe. Let them know that it's okay for them to feel stressed out. It's okay for them to feel upset. And also let them know that they have a very small chance of catching this disease and getting sick from it. That yes, even if they catch it, probably it's just going to be a cold. They're not going to really be sick, and they shouldn't worry. So that's the thing. We have to deal with worrying the children. We have to also worry about our children and whether they're getting adequate nutrition. There are many children that got their nutrition from school. And right now, they're not getting adequate nutrition. Some of them are going hungry. So family members have to reach out to children, you know. And then, of course, there are children that are in abusive homes. I mean, I have a lady friend here. She has an autistic child that is about maybe 13 or so. And man, she is so, I mean, she's a Christian, and I don't even know how she does it, but one day she told me, she said, I have not slept in 3 days. Millie is bouncing off the floor. When are they going to open schools? I can imagine, because she's an African lady, but you can imagine how many children are being abused, how many children's heads have been bashed in. Now the crisis center, they're getting more calls and stuff because of that. So now we need to think about, you know, children being abused. We have to make ourselves available for the children, for them to listen.
Yeah.
We got to make sure that we're available to hear the children, to talk about their fears. We got to discuss these fears with them, because some of the times they watch TV or they see it on the phone, and what is being released out there in the media just for maximum effect of panic. So that way we make sure that they release it. We have to provide age-appropriate truths to the children. It's better for you to pull up the data and say, okay, child, listen, this disease can make anyone sick. But for most people at your age, they're not going to get sick. So look at this. It's very, very low for you. Older people, grandma age, they can get sick. But this is what, you know. So we have to provide some of this data, and it will be more reassuring for the children. And then also teach them that, good. We also teach them that, listen, let them just be healthy, to wash hands, you know, and do everything that we're doing. But we have to kind of give them an idea, how do I call it? Empower the children. Because when you teach children and you empower them, it takes away their anxiety.
Yes.
Teach them harsh watching, sneezing, all that stuff. You know.
Thank you so much, Dr. Stella. Nia Song and Sister Sylvia, we have a participant on the line with a 301. They can unmute themselves if they have a question to ask. But real quick, Dr. Stella, thank you so much. We had actually done a show earlier this month about school closure, where we addressed all these things, but I'm glad you're bringing them up again. So Nia Song will be in and out. So Sister Sylvia, I don't know. Okay, I don't know if one Nia Song to speak before he goes back or what. It's up to you guys.
Well, this is Asonglefac. Am I on?
Yeah,
yes,
you're on. We don't see you.
Yeah, that's right. I don't know what happened to the camera here.
We'll see
So,
yeah.
no, okay. Yeah.
I still have a few more things to say before we go.
Yeah.
I was going to go for the medical part. Yeah.
Dr. Stella, don't go away, please. This is Asonglefac. I've been in and out. The fact is that there is good news on my part, and that is why I'm in and out. My wife has been in the hospital. She's just been, do they call it extubated? I don't know, this afternoon.
Oh my God.
Our God is a great God. They were supposed to extubate and do a trach, but that will no longer be necessary.
Thank you,
God is a great God.
Jesus.
So
Hallelujah.
please, the hospital wants to call me so that she can talk to my grandson who lives here with me.
Yes.
Oh my word.
That was the beginning of the story last night. She talks to him at 11:40 last night, and they had not yet removed the tube and so on. But now she's off it and she wants to talk with him. So please, I'll be back later on. Thank you.
Bless the Lord. We bless the Lord. We bless the Lord. Hallelujah. I
want to say something, Niason. On behalf of Africa Online Media Corporation, I really, from the bottom of my heart, want to thank you for your faithfulness. This is the first time we are mentioning what he's been going through on the air.
Yes.
Sister Sylvia, you will recall about 10 minutes before one of the shows, I don't know if it was last month, his wife had to rush to the hospital.
Yeah.
He couldn't make it on that show 10 minutes before airtime, but since then he's been on the show.
Yeah.
In spite of what he was dealing with in his own household.
That is true.
This is an African with a heart of gold. When you talk about commitment, you see, all of us here are volunteers, nobody gets paid. But for this son of the soil, for this faithful man who's been our chief executive producer from day one for the 4 years and has been faithful, you know, both on the forum and on this show. People on the forum don't know what he's been going through, but he stayed active. I honestly want to tell you, we prayed for your wife, and believe me, we're gonna have her on this show. By the way, he's a frontline worker. That's how she got infected. And for her to have been in the hospital all this time, and the husband is still on this show. God bless you. That's all I wanted to say. Sister Sylvia, over to you.
That is why.
So much, please. That's continue with the program. Continue with the program. Thank you.
That's why, guys. That is why all healthcare workers need to be on prophylactic hydroxychloroquine. All of them. I'm telling you. That is what I see COVID patients every day. All of us are on prophylaxis.
Okay.
I see them every day.
Thank you.
Asonglefac, if you need to leave, that will be fine. I'll go ahead with the program because I know it's distracting for you, and the families first as far as we are concerned here. So you've done your part for the day. If you need to excuse yourself, it is well with me.
Thank you very much. I'll see you later. Thanks.
Okay. So Solange is on, and we have another participant, 301. They will need to unmute themselves, Sister Sylvia.
All right, 301 participant. What are the 4 digits for my phone? What are the last 4 digits of the phone?
5633.
301 with 5633, last 4 digits. If you want to say something, please unmute yourself. You have the floor, whether it's a question, a contribution, suggestion, thought process, they're open for you. 301, area code, please unmute your phone and say something.
And Reverend Solange is on too. She's muted, and we're also streaming.
Hey, Reverend Solange, welcome.
Amen.
Yeah, I had since our 301 call is not unmuting, I'm sure he'll maybe just be listening in, which is what I do. I had a question for the doctor. I believe I don't know if I misunderstood you, but please correct me. I just need clarification. You did say that children, it's not. You said children cannot pass on.
No. They think. I'm not saying they cannot. They are okay. Like I said, we are still everything in COVID is a moving target.
Yes.
Right now, experts and experts. I don't even know what the experts are saying because the experts too. They are whatever they are telling us is moving. It's a moving target too. Experts.
COVID-19.
I know, right? Experts are saying that okay, the children do get infected. Most of them catch the infection from a family member they live with. The virus seems to cause a milder disease in children, maybe just like a runny nose or something. And then most they have, although there have been cases of kids developing more serious symptoms, most of the time they just have a mild symptom. So, and the experts are saying that children do not really transmit it. But like I said, everything experts say right now is a moving target.
The question mark. So it is. We are correct to say that a child, if I'm
it's not as transmissible, yes.
Yes, if I'm COVID positive as grandma, and I'm with my my grandchild or grandchildren, I can pass it on to them.
Yes.
But chances of them passing on to me are like a little bit slimmer.
I will not say that. I will not want to put a COVID positive child near a grandma. Period.
Exactly.
But what I'm saying is that right. They say, like I said, we don't know because, like I said, this thing is new. If you have a COVID positive, if grandma has COVID, and I would be comfortable for my 7-year-old child to visit grandma that has COVID, because the 6-year-old child will probably not, even if they catch it, they'll probably not have a serious disease. I've treated a lot of patients, I've treated a lot of patients that grandma is sick, grandpa is sick. The children were with grandma and grandpa all week, and the children don't have no symptoms, none. And then maybe their 23-year-old, 25-year-old mother maybe has a little cold, you know what I'm saying? So 23-year-old mother might have a little cold, the children, no symptom. And I've had several cases where the grandchildren are around grandma and grandpa. Grandpa can't breathe, grandma can't breathe, and children are like totally fine. They're just running around. So that is for younger children, but and I didn't get but
I'm sorry.
And then there's yeah, you were saying something. I said, so that is the thing with children. Their likelihood of catching the infection and having they can catch the infection, just about everybody, but their likelihood of having a serious disease is very slim. They don't get a serious disease, they get a mild.
What about a pregnant woman? If a pregnant woman is due, like she has COVID and she is in, let's say, her due date month, ninth month, she's giving birth next week, or in other words, this thing has already intubated the 14-day period or whatever, but she's still sick.
Yes.
Does it get transmittable to the newborn, to the infant that is inside her?
I don't think COVID is not transmissible by blood. It's actually an upper respiratory transmission. Yes, because it's a respiratory transmission, it's a droplet transmission. And a child in the womb is relatively, if the child might probably come out of there with antibodies to COVID, actually, because the antibodies transmit in the blood, but the virus itself does not transmit through blood. At least it hasn't been showed, So yeah, so they've had a lot of pregnant women come out of it and give birth to children, and they were fine, and I had one colleague who was talking about a baby that was in the ICU that came out, she was brought preemie, and they ended up with COVID, but the child also did well and went home. But it was a little dicey there. Okay, so now that they are rethinking, experts again, moving target. They are now rethinking that there's new evidence showing that children may become sick, and they are beginning to learn more about the children that are at risk and what their parents need to watch for. So they are saying that, just in that, they say in the past week, they've had children hospitalized, like in New York, with the multi-system, this thing, and 3 children have died, 3. But this is what we know. Okay, when they talk about this multi-system disease, they call it, it's a Kawasaki disease. It's kind of like a inflammation that goes through the whole system. Do we know whether it's caused by coronavirus? We don't. Do we know whether it's Kawasaki? We don't know yet. Something. So even though they have the multi-system disease that they're talking about, they don't really have, it is still they say it has killed 3 children. It's killed in New York Presbyterian Hospital. They reported 3 children. So is it possible that these 3 children had Kawasaki disease and they were positive for COVID? We don't know. Because Kawasaki is common in children too. The multiple system disease that happen in the children is about the same prevalence with Kawasaki. And they get cough, fever, nasal congestion, rhinorrhea, they get sore throat, illness, and then the outcome is usually good. So this particular one has killed 3 children. The hospitalization is more common in pediatric patients below the age of 1 that have underlying problems. If you have a child that has maybe heart disease, had maybe a valve disease, or had maybe some genetic malformations, usually they are more likely to get sick and more likely to get hospitalized. Or maybe a preemie child that came in, was born preemie, and they will react to the COVID probably the same way they will react to the flu.
Excellent. Thank you. Reverend Pam, I think another guest on. Can you please welcome our next guest before the doctor continues?
Yes, thank you so much. I would like to welcome Dr. Dita Foster. You're actually muted, Dr. Foster. Oh, there you go. Thank you so much for joining us. Dr. Dita is one of our pioneer medical squad members, and he has about 100 siblings who are all doctors. I always say that because I can't keep track. Dr. Dita, you are welcome. And today we are talking about COVID-19 and children, also with the recent CDC alert of the MIS-C, the multi-system inflammatory syndrome in children. And we have Dr. Stella Emmanuel, who's on the show. She's joined our team. So Dr. Dita, would you like to weigh in on this topic?
Thank you, Reverend Pamela, and fellow viewers and audience of Africa Online. Good afternoon and good evening. Thank you for the opportunity to participate in this emancipation quest by Africans for Africans. COVID-19 is a contemporary disease, and it's been discussed everywhere because it's affecting everybody, either directly or indirectly. More recent data suggest that the younger generation may not be as immune to serious infection as we may have thought. That said, those who end up with the most negative outcomes have been noted to have a lot of comorbidities, mostly comorbidities. I just came on the show, and I would love to acclimate myself and get the flow of things, maybe with a pointed question before I get this discussion going partially, because I do not want to be repeating information
what
that
I
has already been discussed.
Exactly.
Yeah. Let me say one more thing. Okay.
Yeah.
Okay, one of the studies they did in children was a large study they did in China. They had over 2,000 patients. It reported, okay, I actually just have it on. Say, okay, the largest study of pediatric patients greater than 2,000 in COVID-19 in China reported that illness severity ranged from asymptomatic to critical. Asymptomatic, no signs, about, no signs, normal chest imaging, about 4%. Mild symptoms, fever, myalgia, flu-like symptoms, 51% of them had mild symptoms. Moderate, which had pneumonia with symptoms, subclinical disease. That means they had pneumonia, but it was subclinical, so they didn't really pick it up. So they say about 39% of patients. Then they say about 5% of children get sick, but those that get critical is 0.06%. As adults, older people, we're looking at, almost 15%, but this one is like 0.06%. So based on these early studies, children of all ages, they are at risk of getting COVID. However, complications appear to be less common among children compared with adult base. In fact, I can't remember where I saw that, but they said something about because of the COVID disease, sometimes it's almost like a lack of oxygenation. They believe that children are probably protected because they still have a higher level of fetal hemoglobin. So that was just something they haven't done, they kind of commented on that. I can't remember where I found that. So basically, so now they've had infants below the age of 1 are those that end up getting hospitalized. And then I'm still looking at this multi-system inflammatory disease syndrome. The CDC said it actually kind of coordinates with the same prevalence of Kawasaki. So we don't know. Like I said before, is it that these patients had Kawasaki and they were COVID positive, or COVID is causing it, or is the same kind of cytokine storm that gets released in COVID in children? Like I said, they are still looking at it. But they say CDC is collaborating right now with international partners to investigate this report. It is still being studied. They don't know yet, everything. Patients with this disease have presented with persistent fever, signs including multi-organ, cardiac, gastrointestinal, kidney, hematology, everything, just the way Kawasaki will present, involving, and then all the inflammatory markers like the things that we get, the chemicals that we find in the body during inflammation. I'm talking about, ESR, C-reactive protein, and all those things, white count, they're all high. And so they said these symptoms, it might begin after maybe weeks. They say it usually presents weeks after the child got infected. Usually adults, it's been running so far around 14 days, but they said these symptoms may begin to present weeks after the patient gets infected. So some people are thinking it might actually be an immune response to the antibodies of the COVID, but like I said, it's still being studied. And they say children that may have the MIC evaluation for signs and symptoms may include, but not limited to, chest, X-ray, echo, blood testing, and stuff like that. So this is still being tested, is still being looked into. So they've reported 3 deaths so far, but we don't,
All right, thank you.
The international community is still looking into it.
We do have Dr. B. Tazong also on the line. Dr. B, you want to weigh in, or you want to address a question from Sister Sylvia? Then Reverend Solange, when you want to ask a question, you can unmute. Dr. B, are you there? Dr. Tazong?
I don't see his number up here.
No, she's on there. She was the one with the 301. She texted me.
Okay.
Okay, over to you. So I'm just letting you know, I have 3 physicians, and I know Dr. Ogoji will be zooming into. So Sister Celia, over to you. You want to ask?
Yes, Sister Solange has not said anything. Sister Solange, can you unmute yourself, please? Did you want to weigh in on this or ask a question before we proceed? You've been awful quiet.
No, I don't have any question at the moment. I'm just listening and gathering, maybe something I'm going to ask which relates to children and the COVID. But I would really love to hear from all the physicians assigning late, for personal reasons. But I'm just listening. I know I have one or two questions, but let the physicians, the experts, they're just educated.
Sounds good. Thank you so very much, Sister Solange. Is our doctor with the 301 number unmuted yet? I mean, can they come on?
Dr. Tazon, that's Dr. Tazon.
Yeah, Dr. T, can you unmute, please?
I like the way you are calling her Dr. T. You are an African woman. Say her name. Her name is Tazon. Don't be.
I know her name is Tazon. I just said Dr. T.
No,
I need a head.
We have Dr. Dita, Dr. Tazon, and Dr. Emmanuel or Dr. Stella.
No, I'm saying I call her Dr. T to get a rise out of her, so she can say, don't call me that.
Okay.
All right. Anyway, Dr. Tazon is not online yet. Regarding the children, with the way that this transmission, if I may call it, is coming onto them, you were saying that all of them do not exhibit the same symptoms. So yeah, among the symptoms that are being exhibited, what's the most common one that me as grandma, with all these grandkids that I have, if I had to, let's say somebody's sniffling right now, should I start getting worried? Or somebody has just a small cough, should I start getting worried? Or
not for children.
Okay.
Usually with children, like I said, with children, they have their symptoms present like a mild cough, runny nose, like flu-like symptoms. Yes. And I would actually just be supportive on, if the child has a cold, children have colds all the time. I will not get crazy if the child is having a cold, because if you feel that if they're running a fever and the fever is persistent and they are looking sick, one thing that we do in pediatrics is, you always hear a pediatrician say the child looks good. Something they look good. If they're looking sick, then you want to probably do some blood work and do a chest X-ray. Usually, the chest X-ray is usually pretty much diagnostic. If the child is getting a more serious disease, but I will not run off the first time the child has a cold and maybe a 100 or 101 fever. You give him some Tylenol and the fever goes off. I will not panic. You know what I'm saying? So they say here, even this multi-organ failure in the UK, they reported 8 cases of very sick children with that multi-organ thing, and only one of them died. But of course, 75% of them they were African-American descent. So,
so Dr. Dita, would you like to weigh in on that one?
That brings in an important aspect of the epidemiology of COVID-19 as we understand it today. Please don't forget that 80% of people, especially adults, are walking around like me and you, having 0 symptoms and yet having COVID-19. In fact, that's why one of the most common recommendations is, even if you're going out shopping and you feel healthy, still prevent yourself, because the next person pushing that cart next to you may just be a COVID-19 person. And then the next 15% of people have some symptoms. Some may just feel like they're exhausted. I tell people they commonly feel like they've been working all day. They have very little energy. They feel like they've been kicked by a horse. Then fevers, high-grade fevers. You break out in a sweat. One of the things I commonly describe to us Africans who are familiar with malaria is commonly people turn around and say, I feel like I've come down with malaria. The other day, a friend called and said, gee, I've come down with malaria and I'm looking for malaria treatment. And I asked, when was the last time you traveled to the malaria area to think you're coming down with malaria?
5 years
and
ago.
I cautioned, and eventually he was diagnosed and admitted with COVID-19. And thank goodness he's out of the hospital now. So you have to listen to what Dr. Stella said, that if they are healthy, you keep them at home. Now, the reason you would want to know whether they've been exposed or not is to prevent the spread. Because even though the child may do well, the grandma may not do well.
Yes.
The grandma who is currently receiving chemotherapy may not do well. The grandma who has diabetes and high blood pressure and may be on dialysis may not do well. The grandpa who is recovering from multiple myeloma may not do well. And so you like to know whether they've been exposed or not, and then do preventative things, not so much that they are going to crash, but you want to break the chain of transmission.
Absolutely.
And actually, that's why I also would argue that treatment may or may not be effective, and that's why studies, scientifically proven methods to study the effectiveness of treatment is key. Because when I give treatment and the person runs around, the first question I ask myself is, are they part of the 80% that was going to not feel anything? Or are they really part of that 5% that was going to end up needing more aggressive care?
Thank you so very much. We have Dr. Ogoji online as well. Doctors, you are giving us some very, very, very valuable information. This is fantastic because I'm learning a lot as well. As as we're going through all these discussions, I just want to give you a very hearty thank you to both you doctors that are online. Dr. Ogoji, good afternoon.
And he's wearing his hat, so we have two doctors with hats today.
It must be a doctor thing.
Yeah, we have 4 minutes to the top of the hour, and I think Dr. Tazong was activated now by Dr. Ogoji.
Dr. Ogoji, can you please come online and weigh in a little bit? We're talking about children and their COVID infection.
Yeah, COVID infection in children is real. It do happen. It's most children, like most young healthy adults, will do well. A few children will get sick and may suffer some fatality from this, as expected. Of course, the key in children is this is new to all of us. We have to find a way to let children know about COVID, know more about COVID, and know what to expect, and reassure them that, look, COVID is real, it's there, but it's very unlikely to harm you. But more importantly, the role they have to play is to prevent themselves from getting infected. Because if they get infected and go give the grandma, grandpa hugs and kisses and things like that, they might spread the infection. This disease is very, very troublesome because we don't know much about this disease. We only have to find a way to deal with this disease and then avoid spreading it to people who are more vulnerable to the condition.
Thank you so very much, Doctor. It's so.
Listen, I have an update. I have an update from the last time we were talking. Remember the last time I was on we were talking about we have an article that was published in the American Journal of Epidemiology, published May 27th. And this has been real. And of course the media is not carrying this because they don't want to. There's more than 1.6 million Americans. What they did here, that they found out in this article, that they did a study and they found out that hydroxychloroquine and azithromycin, it's very effective in treating COVID outpatient in an early window. It says here, this thing that hydroxychloroquine and azithromycin have been used as standard of care in more than 300,000 adults and with multi-comorbidities with estimated proportion of diagnosed with cardiac arrhythmias. 47 out of the 100,000 users had estimated mortality of less than 20%. So the 47 patients out of 100,000 had some cardiac complication. Compared to the 10,000 Americans that are dying each week, this medication needs to be widely available and promoted immediately for physicians to prescribe it. This study was done in Yale. So now we do have, yes, we do have a study right now that has come out and they're like, listen, and of course, nobody's carrying it out. Make sure this thing is available. It works, outpatient, early treatment, early window of treatment, and they should make sure that they don't let these patients get to the hospital. You see, I say that more than...
Doctor, can you wait for a second? Hello,
Doctor.
Doctor.
Presentation, yes.
Can you wait for 1 second, please? We're coming to the top of the hour. Reverend Pam, please. I'll have the doctor come back up after the announcements for the top of the hour.
Thank you so much, and yes, we are just excited. We actually have a baby doctor. We have a woman doctor. Dr. Dita, when you let you speak, please just tell them your specialty, and Dr. Bitazo, just let them know what your specialty is. But I just want you guys to know how smart we Africans are, we Black people are. We are very smart. Don't let anybody tell you anything else, and that's why all of our brains belong to Africa. And every one of you here are part of Africa's brain bank. We're going to put all these brains together I would make the announcement briefly, then I need to leave for a second. So Sister Sylvia, you have the show, but we all know what is happening in this country. You know, all the protests going on. Next week, starting tomorrow, we're going to be talking about racism against Africans and Black people. This is not new. It's been happening for centuries. But that's what we're going to be talking about. We're not going to be focusing on just police brutality because it goes beyond police brutality. Again, Sister Sylvia, I would like to come back to this announcement because there's a very critical phone call I need to make.
Not a problem. Not a problem.
So about 15 minutes into toward the end of the show, I would like to continue the announcement, but that's the topic we're going to be talking about. Racism. And I want to invite everybody here to be a part. I mean, Dr. Stella is always here. Dr. Ogoji is here. I want to invite Dr. Dita and Dr. Bitazong to also weigh in. You guys are part of our medical squad. We are raising awareness about issues that affect Africans and Africa and seeking solutions to those issues and hopefully make progress. So I'll hand over to Sister Sylvia. Please, for our 4 doctors who are on the line, when you come to speak, just let us know your specialty. We have 21 minutes to the end of the show. So Sister Sylvia, I'll come back. Let me just mute myself briefly and make this important phone call about our people.
Sounds good. Dr. Taizong, I'm going to have you speak right after Dr. Emmanuel finishes because she was in the midst of talking when I abruptly cut her off. Dr. Stella, please continue, and then I'll have Dr. Taizong come on.
Yeah, I was talking, okay, like she was talking about specialty. I'm actually a trained pediatrician, and then I did emergency medicine. So I work in the emergency room, and I do run and I have an urgent care type clinic, walk-in clinic, urgent care, and I see all ages. Of course, you know, back home, we all trained to see everything. So, but when I came to America, I did pediatrics. But for the past 5-6 years, I've been doing emergency room and actually taking care of. So I do have like an urgent care type clinic, and I think we practically take care of, like this past week, I probably saw about maybe 15 COVID patients. You know, one of them is actually admitted in the hospital right now, but we've been able to practically keep almost every one of them out of the hospital. We had one got intubated early, but so far it's been good. So I'm actually in the front line of taking care of these patients every day, you know. So we have been the people that have been fighting tooth and nail with many other doctors in this country for them to release the ability for us to use hydroxychloroquine, which we think is very effective therapy. That's why I was giving that update.
Thank you so very much for that update. Beautiful. Dr. Taizong, are you online yet? Have you unmuted?
Yes, can you hear me now?
Yes, good afternoon and welcome to the program. Thank you so much for taking your time out to come and join us. Could you please weigh in on that? I'm sure you've been listening to the topic at hand, but before you do that, we require of you to please formally introduce yourself and your specialty so we know who we are talking to, and when people are asking questions, they know who to direct it at.
Sure, ma'am. I'm a preventive medicine physician, and so basically public health. And that's right now I do a lot of outpatient medicine, a lot of clinics, sometimes urgent care and all that good stuff. So I'm going to defer to the people that spend more of their time in the hospital because I think they're meeting this beast up front more often than we do outside. But from a public health standpoint, I just have to point out a few things. We are always trying to strike a balance. I mean, the other thing too I'll say is right now I live in a hurricane-prone zone. So I live in the Myrtle Beach area, and we always have hurricanes. And the local governments and the state government always have to strike a balance between inciting fear and pushing people to action. And I think if we get too comfortable, people are not going to do what they have to do. But if you scare people too much, then you have another problem that you have to deal with, anxiety and all that good stuff. So you have to strike a balance, push people enough, but give them enough tools to build their confidence that they can do. They have some degree of control or some degree of intervention that they can use to help themselves. And I think that's really what we want to do. So I would say that let's avoid extremes as far as viewpoints. And then the other thing too, because I think it's something that everybody is sensitive to, we should keep politics out of medicine and out of public health because it's affecting the way that people can absorb and give out information and medical care. We want to really stay focused on what is right and true. It sickens me when non-medical people try to tell medical people how to practice medicine. If you want to practice medicine, there's nothing wrong with that. Go get the training. And that's the same thing. I tell people I can't go tell an electrician or an IT guy how to do their job. That would be crazy. I don't have the experience to do that. I don't have the training to do that. And so when we start doing that and we start mixing politics with healthcare, it makes healthcare very challenging because we have patients that we're trying to help. And when the patients come in, they already have blinders because of their political affiliations and ideas. And it makes it difficult for us to get through to our patients, like, what do you need to do or what do you not need to do, or how can you help yourself and how can you help other people? And we can see it every day in what's happening in this country right now. And that is very unfortunate. I think that all of us in medicine and everybody actually should be making a very important effort to keep things in lane. If you're a politician, stick with your whatever it is you're doing out there. Don't get into things that you have not been trained to do, and don't try to impose your opinions and ideas on people that are diligently trying to do the right thing. It makes it really hard, even for me as a physician now, when people say certain things about certain things, it makes me wonder, because I don't know if they're trying to ingratiate politicians or if they're actually being honest scientists. Thank you.
Excellent. Thank you very much. That was very blunt.
True that.
That was a very good and blunt statement that you made, and thank you very much for sure. Medicine and politics shouldn't be mixing, because when the heads of states make certain points or statements regarding medicine, which they have not studied or which they have not even researched, once the word goes out there, people take it for gospel truth. Dr. Dita, your view on that?
Yes, I am a gastroenterologist, practicing gastroenterologist, and I am a public health expert with masters in public health as well, with epidemiology as my main focus. I spend a lot of time doing global health and global health impact initiatives, as well as being the co-founder or founding member of the Southern Cameroon's Medical Society. Regarding the practice of medicine, certainly there is a scientific method that we have all agreed to, and so the information that comes through the scientific method is what we rely on a day-to-day basis for our decision making. In the past, we had something called the Koch's postulates that would say, to definitively prove something, you see infection. When it's there, you take it away, the infection disappears, and you reintroduce it, the infection comes. And that definitively would establish a causality relationship to a definitively proof information. One of the things we know is COVID-19 is an emerging infection, and therefore we are early in the course of this. And because we are early in the course of this, I am always hesitant to be conclusive. Information is constantly evolving, and as we gather that information, decisions that were relied or that were made based on evidence today may completely be wrong in a week or two. But let us be guided by those scientific methods and those principles. Certainly, one of the things I promised myself when I came up live on your show was to focus on answering questions and not engage in political undertones or make it a debate among the healthcare professionals and practitioners that are on the show. That would be a disservice to Africa Online and the people that are our audience. But the foremost, I would say there is a method to the practice of medicine, and I will hold myself to those methods and the data that's driving it. And one of the things I also want to add is it should not be politics, because this is a pandemic. It affects the rich, the poor, and it affects people in Africa and in the Western world. It affects people on the equator and in the temperate regions to the same devastating effects. It affects people across the Atlantic to the same portion, and their decision making is completely independent of decision making around other areas. And hopefully, because of that, one of them will be able to power the practice of medicine with that scientific method that's rigorous to build confidence in the decision making. Thank you.
Very true. I'm very glad that all the doctors were on one page and all of us talking about the same, all of you, I'm sorry, I'm not a doctor, my apologies. All of you talking about not making our debate and discussions political, especially when it comes to this COVID-19. I applaud you, doctors, because you are speaking the truth of your experiences. You are in the front line. You are the ones dealing with those patients on a daily basis. You are the ones who have to deal with the trauma. You have the one who has to deal with all the stresses that those people are coming in with. So to that, my hats off to you, doctors. Dr. Ogoji, weigh in, please.
Yeah, my name is Dr. Ogoji. I have a double specialty. I am a obstetrician and gynecology. I'm also a family medicine practitioner. I also do telehealth, so I see everybody from birth to death, and I deliver women.
I like that.
I take care of, I also do hospital medicine where I deliver pregnant women and take care of children who are sick in the hospital. So that's my background. So regarding politics and medicine, it's very challenging. I think it's high time that doctors get involved in politics, so because those who are making the laws for us are the lawyers. It's very okay for a lawyer to approach my patient and say, hey, you go sue Dr. Ugoji and you don't pay me anything. When we make a profit, I share the money. That's okay for lawyers to do. But it's not okay for me to approach a general surgeon and say, hey, I will send you all my patients that need surgery, end of the year we'll share the profit. It's wrong.
Yeah. Kickback.
So, it's called kickback, but kickback is okay in law practice, and that's what has affected healthcare system in the whole, especially in this part of the country, this part of the continent. So we have to get involved. We have to speak up. We have to have law doctors with law background that can go into politics and defend the interests of doctors. Of course, based on practice of medicine itself, there's a lot of regulations which we are supposed to abide on, which is not a bad idea because that keeps us on our foot and we do the right things that we can do it. However, there's that fine line between practice of medicine because you are doing the right thing or practice of medicine because you are afraid of being sued. Defensive medicine, defensive practice. So we have to be careful when you become more defensive than when you do the right thing. So that's the problem. And then when you come to public health, it's an interesting concept that this COVID-19 have showed us that politics is a very big influence in healthcare in this country. Majority of Republicans in this country believe that COVID-19 is a scam. I'm sorry, most people, and then they believe that what Trump is doing is right, while majority of Democrats believe that Trump is not doing enough. All we know is that COVID-19 is real, it's devastating. There should be a balance between how do we take care of people and prevent the spread of this disease. On the other side of the continent, I like to mention about Africa and continent. This is Africa Online. People might crucify me if they want to, but I would strongly believe, again, I strongly believe that in a country like Nigeria, where they shut down the economy for over 2 weeks or 3 weeks or 1 month because of COVID-19, I would say it's wrong because more people are dying of malaria, Boko Harams, poverty, hunger than COVID-19. COVID-19 enters the country, he will go to Abuja and deal with all those politicians who come to America, go to London, go to Europe to get healthcare, and yet there's no functionally hospital in that country. This COVID should teach them a lesson that make sure in every state in that country, there is a functional healthcare that can take care of us. Make the healthcare so that you people who are the lawmaker, when you are sick, like Gaddafi, when you're sick, if you are sick, you get care in Nigeria. Some apply in Cameroon. When there is sick, you get care in Cameroon, not France, not Sweden, Congo, Liberia, and so on. So COVID-19 is real, but more people have died in Nigeria in the past 1 month from hunger, police brutality, poverty, Boko Haram insurgency, and Fulani herdsmen than COVID-19. So that we have priorities misplaced.
Thank you so very much, Doctor. Very much appreciate that information that you have shared with us regarding the greatest healthcare systems in Africa. Actually, this is a topic that has been very ripe on one of our leaders, Dr. Arikana Chomborikwa, who keeps talking about why do presidents leave their African countries to come to Europe, to come to the United States, to come and get treatment, yet your own people in your country are suffering and they cannot be given medical health care. You are so very right that we need to get to our politicians so that they understand the importance of us getting the best healthcare, and even some of us getting free healthcare, depending on which part of the world, of course, you're from. But when it comes to the continent, like we've seen, we have very, very educated doctors, underpaid doctors, nurses, and so forth, all the health personnel that take care of us when we're sick or when we're dying. So it is a very important topic. I guess maybe it'll be a topic for another day or another month or another week, where Africa Online can also actually bring in some experts so that we start talking about that and see the way forward. Dr. Stella.
I think Dr. Dita was trying to say something.
Oh, sorry, Dr. Dita, go ahead, sorry.
I wanted to applaud what Dr. Goji said, but bring it back to COVID-19. One of the things that's been disheartening and frustrating is the lack of African solutions, an African approach to a global problem. Several months back, Africa unanimously did not evaluate the state of the social interactions in declaring a global lockdown. And all of a sudden, without rolling out parameters, they declared an open society. I think it is high time that us Africans, and interacting with different African communities, ensure that we are tailoring our solutions to fit the African experience. There should come a point where one size does not fit all. I also say so to caution that the approach to COVID-19 in the United States or in the Western world should not and will not be the same approach to COVID-19 in our African continent. For example, we operate in a resource-limited setting, and to hope that everybody would have a ventilator where they will be placed on to support them is going to be different. To also recognize that, I mean, maybe by luck or by chance, we don't have a lot of the chronic illnesses because we've allowed that population to die prematurely. Maybe by the age of 70, a lot of them have died. And so we're not even dealing with the elderly population that commonly would come down with the worst outcome for this. Or instituting social distancing measures in a manner that's not compatible with our society. We have open markets, we travel in overcrowded buses, we shop in open markets, and just in a setting that we know social distancing is not the best approach to just throw it out there. Or dealing with people who are operating in a resource-limited setting and yet arresting people and charging them fines for 2,000 when they could not afford a face mask for 500. Some of those things are horrifying, frustrating, devastating, and really make me wonder: are we creating African solutions to combat combat a pandemic that's suitable for the African experience? That's what I wanted to add.
Thank you very much, Doctor. Excellent, excellent. Reverend Pam, you needed to come back and finish the message before we jump on to Dr. Stella.
Yes. Thank you so much for excusing me. I'm actually on another Zoom call on my phone. What can I say? But it's all for Africa, by the way. So the discrimination, we're going to be talking about racism. We have tackled this topic before twice, how Africans are being treated around the globe, even on the continent. So this discrimination is not just by the non-African or the non-blacks, even our own African people discriminate against us. You know, those of you who were at our launch last year, the Africa's Brain Bank launch, we all know our beloved sister, Dr. Arikana, was our keynote speaker. She actually expressed during her speech that when she went to Africa, at the airport, she couldn't get the porters to help her with her bags because they were waiting for the white people to come from Italy or from the plane because they tip more. That's our own African people. You go and open a shop in Africa and a Chinese man opens a shop next, they will patronize the Chinese, but we on Africa Online and Africa's Brain Bank and all the other legitimate organizations, that we're going to change all that, starting with us here. We are going to do it. And it gives me a lot of pleasure because just today, before we got on the show, I got email confirmation that our sister, the former AU ambassador to the US, Dr. Arikana Chomboriko, is going to be our guest here on the 14th. So mark your calendar. I'm not going to announce the topic yet. I will release that topic next week. But I just want to let you guys know she will be our special guest on this show on June the 14th. But next week, we're going to be talking about discrimination against Africans and Black people. That's what we're going to be talking about. And I want to put Dr. Dita on the spot. I am glad you talked about your specialty because I've been looking for a GI doctor. I have some of them in my family, but you know how relatives are. So let us know which month end you are available so that we can talk about GI disorders among our people, especially gastritis. A lot of Africans have gastritis. So Dr. Dita, let us know. You can inbox me privately which end of month you'll be available to be on the show as our special guest and also to take some GI questions on the forum. As you very well know, we have not discussed GI as a topic, a health topic. Over to you, Sister Sylvia.
Thank you very much, Reverend Pam, for the updates. And the doctors online, again, thank you so much for being so attentive and so supportive and all the valuable information you've given us. Dr. Stella, I think I'm going to end with you so that we have your view as well on politics and medical practices.
I'm sorry. We have another participant named Love. So after Dr. Stella, you might want to give them an opportunity to ask a question. They just zoomed in. Sorry.
What's the participant's name?
It just said Love's iPhone.
Okay.
They are muted. So after Dr. Stella, you can give them an opportunity.
No problem. Thank you. Dr. Stella.
Dr. Stella is muted. Okay. Dr. Tarzan is still on. Dr. Stella is muted. I don't know if you want to go to Dr. Tarzan.
Let's give the new caller a chance then.
And
what's the number?
It just said Love's iPhone. Maybe they don't want to speak. I don't know. I just wanted to acknowledge them.
Love's iPhone, would you like to say something? Can you please unmute yourself so that you say something? Otherwise, we'll continue.
Hey, good evening.
Good evening. Announce yourself, please, and your profession. Are you a doctor?
Oh, no, I'm not a doctor, but I work in the industry.
Excellent.
Yeah, I'm sorry. I came in a little bit late because I didn't even know time has gone this much. By the time I look at the time, I'm like, oh, time is gone. And so I just zoomed in. Unfortunately, I haven't had so much, so I may not have so much to contribute for now.
Okay.
I really appreciate the program and it's timing and a lot of innovations in the African world, both the Black people world. Let me just put Black people world because this is more of a Black people affairs. It doesn't matter where you're coming from in Africa or whether you have never even been to Africa, but you are Black, So this is a Black race thing, and for all the innovations you people are putting in is highly commendable. And I wanted to really appreciate all your efforts. And by the special grace of God, it may take time, but we surely get there.
Amen. Is that for Luke? Is that for Luke?
Yes, ma'am.
That's our beautiful sister for Luke. You can actually watch the entire program on Facebook. We're streaming on Facebook. Over to you, Sister Sylvia.
Thank you very much. And Paula, thank you so much for your contribution and for listening and for being an participant today. You may not have said much, but you truly did say a lot, just a few sentences, whatever it is that you said. Thank you for your time. Among the doctors, your last words, let me start with Dr. Dita. Your last words, please, 1 or 2 minutes.
Yes, thank you again for the opportunity. Reverend Pam, you know, I would need to look at the schedule, but as you know, my elder brother, Dr. Ivo Dita, has been on Chat Night Africa on multiple occasions discussing colon cancer screening, discussing pancreatic cancer, as he's also a gastroenterologist.
Okay.
Returning back to the topic of today, I just want to ascertain and reaffirm to my African community that COVID-19 is real. COVID-19 has the same devastating consequences on us, whether we are on the continent or outside of the continent. We should pay particular attention and do best to abide by preventative measures. At this time, if we can, we fondly say an ounce of prevention is better than a pound of cure. This is our opportunity to ensure that ounce of prevention. To my public health participants and practitioners on the African continent, recognize that the point of intervention for COVID-19 may not be the same point of intervention in the Western world. The foremost, prevention and delaying the spread of the disease may give us the best chance of minimizing the impact on our continent. And let's try to tailor solutions that are appropriate to the African experience. And to Africa Online, it's always a pleasure and a privilege to appear on your platform to talk to our people, to talk to our brothers, and to enlighten ourselves on our collective plight. Hopefully, we will stay in this journey together.
Thank you.
Thank you
very much, Dr. Dita. Next will be Dr. Tezong. You still online?
Tezong.
I'm still here. Thank you so much, Sylvia. So I just want to say thank you. And I think what every responsible doctor is going to do is reiterate that COVID is real. It is deadly. And yes, the death rate may be quite low. But you know what? When it hits you, it's going to be 100%. And the problem is that you don't know if you're going to be the one who gets hit or not. And yes, there are some people that are at higher risk, but there are people that are over 100 that have survived COVID. And there are people that are in their 30s and 40s as healthy as they can that are not making it or have not made it through COVID. So the bottom line is that you have to balance your fear of the disease with your ability to protect yourself as best as possible. And right now, public health is the key. Good hand washing, social distancing, being considerate of other people, and also doing everything you can in your power to minimize the risk of spread. I can't emphasize it enough. As Dr. Dita said, we don't have a lot to manage these problems in Africa. But you know what? We are survivors. We just need to be smart. We cannot assume that things are going to work out well for us. We need to take charge of our lives. We need to control the things that we can. And for those who believe in God, we need to pray for him to help us with the things that are out of our control. Thank you again, and I hope you have a beautiful week.
Thank you so much again for comments. Much appreciated. Dr. Ogoji, your last words, please.
Oh, I think we lost Dr. Ogoji.
All right, so I'll throw it then back to Dr. Stella. Dr. Stella, please close us out with your comments.
I'm actually, like I said, I'm going to agree with my colleagues right there. Since in the US, since they did this opening of opening of the economy or whatever, when we see all these riots and people together, and we see people in the beaches of the country, just, it scares the living there. We as physicians that know that this thing is real, we're just thinking about what's going to happen in the next 14 days to 21 days, you know what I'm saying? So we need to reiterate the fact that this disease is real, it's deadly. Like my colleague said earlier, if it happens to you, it's 100%. There are people that will not die, but the comorbidities of the lung scarring can live with you for a long time. Children, most of the time, might not be affected that much, But children are dealing with other with other things like emotional things, and children need to be educated on it. And yes, children can get sick too, but we should make sure that we keep our children updated on what's going on. And let's continue to, we can walk and chew gum. I wrote an article that was published in my website that we can walk and chew gum. In other words, we can still be able to manage to go to work and take care of things and manage to stay safe. You know, make sure hand washing, things that you don't really need to do, don't do them. You know, if you don't need to be out there frolicking somewhere, don't do it. Go to work, stay safe. You know, mask. There are people that are fighting against masks. I don't know why, but you know, try as much as possible to keep yourself safe and next person there safe. By His grace, you know, I'm a pastor, so I always use this phrase, you know, by His grace, yes.
Okay, don't start preaching. Don't start preaching yet.
Yes.
Not today.
No, and I'm not preaching. I'm just saying that sometimes it's in your language. So when you speak, it comes out. I said, by God's grace, we're gonna go through this, and we're gonna survive this.
Amen.
And so, but we have to be smart. We have to be careful. And people that are watching back home, be careful. We have big, vast areas. Stay away from. When they say 6 feet, it doesn't mean anything to do it. You understand? Err on the side of caution.
Thank you, Doctor.
Make sure that you and your family.
Thank you so very much. To the doctors online, thank you very much. Reverend Pam, your last words before we close out.
Yes, I'll give my last words, but I want to let you know that Niasong is back. So I would actually, after me, he will need to close out. Dr. Dita, Dr. Ogoji, Dr. Stella, Dr. Bitazong, thank you all so much. And yes, Dr. Dita, your older brother, Dr. Ivo Dita, is one of our pioneer medical squad members, and he's been on Africa Online multiple times. He's also discussed colon cancer, and we're going to have him back, but this time we want you to do the GI. And I just want to thank everybody, and please don't only come on the show when we have a health topic. You know, I will cede some time to Niasong, you know, to close us out because he just got back in. Thank you so much.
Thank you, Reverend Pam. Thank you, all of you out there. Everybody was a participant in today's program. It's been great that we have the opportunity on this Pentecost Day to not just do this topic, but to also receive good news on my part in my family. I appreciate all your prayers. I appreciate everyone. And please let us remain and stay faithful. He has done it. He keeps doing it. He will always do it. He never fails. Thank you all, and please take care.
Thank you very much. God bless you all.
Thank you.
Thanks. Bye.